Tim Ria here live at Digital Health Summer Summit San Francisco with my next guest. Topic was gaining traction, the markets to watch. And we have DeGheest, who's the founder and managing director of HealthTech Capital. You might have heard of this conference that you guys do, and welcome to the show.
Thank you very much. I'm very excited to be here. It was a great conference. We had some great panels. And I think we discussed about what does it take to be successful in the space. And in the specific panel we discussed, we says, what are the metrics of success in the wearable markets? And I think one of the things we need to be very careful is not to confuse raising money and valuation with the metrics of success. The ultimate metrics of success is, do you have revenue? And if you have revenue, that shows that there's adoption in the marketplace and people are willing to pay for it. But the second metrics of success is that can you become self-sustainable? And that usually means getting profits. So we discussed during the meeting that in the quantified self-market, which is mostly the pedometers and all of that, really the majority of the users are young people. It's really more for the fitness market. Only 11% of the elderlies, defined as people over the age of 65, are really buying these products. In fact, very often they don't buy it. It's their family buying it for them. And so question as this industry evolves is that how can it create long sustainable value there, and the accuracy and the ease of use has to go up. And then we had a discussion also on the aging market, and I think Laura Mitchell from Grand Care made it very clear that it's really not the patient buying it, it's not necessarily the family paying for it, it's the home care professionals who are using this as a productivity tool and as a way to make it easier for them to deliver their care in the home. And maybe in the future, there's discussion right now into the capitated provider market there, but it's still kind of early to see can you provide a return on investment and benefit that makes sense for them. So this is a subject that's dear to my heart because I founded HealthTech Capital in 2010, which is an ecosystem of angel investors, venture members and industry members and providers where we really identify promising new company there. We give them the first, what I call organized professional money there, but more importantly, we mentor them. We give them introduction to the providers so they can validate their value propositions. And more importantly, we give them access to the very big strategics. So we have as a member people like GE, Philips, Johnson & Johnson's, Merck's, a lot of very key players in the space. And the reason why I started the group is because I've been a pioneer in this space for 25 years. I was kind of a black sheep for a long time. And really one of my frustration, regardless about how many of my company ultimately were very successful and went public, it was extremely difficult to raise the Series A. And because this space is mostly market risk. And, when you go to somebody to say, give me a lot of money, I have no proof there's a market, I have no proof that anybody wants to use it, it's kind of a hard story. And so that's why I created this group with the idea to say we're going to create an ecosystem where people are going to identify the promising one and mentor them and get them off the ground. And then 3 years ago, we started the conference called the HealthTech Conference, which is going to be in October 14 and 15 in San Mateo this year, where we really focus on how do you build a business. So this is not a demo day. This is really, you have your product, you may have your first customer there. How do you make this into self-sustainable business? Remember what we talked about earlier. So the conference, has in the same location there the payers, the providers, the large strategics, and the investors there. And we're really focusing on how do you build a business, how do you hire the right team, how do you make successful partnership works, what are the needs of your customers. So one of our key panelists, what's the unmet need of the providers, where you have Stanford as a co-host. Amir Rubin is the CEO of Stanford Hospitals, he's going to be speaking there. We have another great panel, which is what are the lessons learned from the successful stars? So we have people who have made it, who have been successful, and they're going to be sharing back to the audience, what does it take to get there? And of course, we have an exhibit hall there where hopefully people who do a lot of business and transactions there, not necessarily investor finding promising company there, but B2B, people making business partnerships and relationship. Because this is what it takes in this ecosystem there. It's not just one person, and I'm trying to convince you to buy my product. It takes a whole village. In fact, in certain cases, it may take a whole city to change healthcare. Yeah.
So I think you pretty much covered everything there in one breath. That was pretty awesome. So I guess looking at your crystal ball, what do you see happen the next 2 years with this space? With is it hype? Is it reality? Who's going to win?
That's a very good question. I was interviewed by the Wall Street Journal, and it created a bit of noise there because I said there's a Series B crunch. And the reason there's a Series B crunch right now is that there's a lot of hype and a lot of easy money, I will say, for the seed and Series A. So a lot of people are getting money there. If you look at the $2 billion invested in the space in 2013, 72% went to seed and Series A. So you have a huge amount of new company there, but the amount of money going for the Series B and C is very low, which means there is a massive crash.
They're not making capital to justify a Series B, or?
So the issue is that you can sell a vision, a seed, and Series A, but when you get to the Series B, people ask for the metrics. And the metrics are how many customers do you have? How long have you used them? Are they coming back and repeat customers? What's your cost of acquisition? These are all numbers. And it used to be that you could probably go and get a Series B if you had maybe $1 or $2 million in revenues and maybe 5 to 10 maybe business partners. Now, because there's so much confusion, so much activity, a lot of the smart money is on the venture side. What they have done to say, well, come back to me when you have $5 million in sales and when you get 10 hospitals or maybe thousands of customers on the consumer side. And so now it takes more time, and a lot of these have selling cycles. Like the hospitals, it can be 12 to 18 month selling cycles, regardless of how good your product is. So you see a lot of M&A acquisition right now very quietly there, where the strategics are buying these companies because they're not able to basically pass that chasm. And then you go to the Series C, and then you have huge valuation because you see private equity coming in there boosting the price up. So it's a very unusual situation. So my crystal ball is that the market has to adjust because it's not sustainable. And so what you're going to find out is some of the people are going to lose money on the seed Series A, so they're going to self-adjust on their criteria there. I think people are going to force earlier intervention in Series B because right now there's a lot of good companies who don't make it, and that usually self-adjust. And then you have the VCs are going to being moved by the very big private equity there to go back into the Series B. So that's my hope of what's going to happen. But this is why we do the conference, because we really want to show the best of the breeds, and we want to give this company a shot to make it.
Perfect. So how do people link up with you and connect up with the conference? And there's so much to go into, but they should just go to the conference you have to press a flash.
Yes, no, very good question. So we have two websites. One is HealthTechCapital.com, and that's the ecosystem we've built of angel investors, venture, and industry. And the other is the HealthTechConference.com, and that has its own website, and we have over 40 speakers, very big names, and all people willing to share back.
All right, Ann, thanks for being on the show, and good to see you.
Thank you.